Black babies born in Pinellas County are more than twice as likely to die within the first year of life as their white counterparts. Could this be due to a lack of access to women's health clinics? The 2018 Community Health Assessment is a collection of survey data gathered by the Florida Department of Health that is used to measure the health of Pinellas and includes specific data on mothers and children. According to this assessment, in Pinellas County from the years 2014 to 2016, almost 7 out of every 1,000 infants that were born overall passed away in their first year of life. For the same years, just over 5 out of every 1,000 white infants born in Pinellas County passed away in their first year of life. At more than twice that, nearly 13 out of every 1,000 black infants born in Pinellas County during these years passed away in their first year of life. Yet black residents represent just over 11% of the total county population, and white residents make up more than 82% of that number. Pinellas is Florida's second smallest county with only 274 square miles of land under its jurisdiction. Of that, St. Petersburg, the county's largest municipality, assumes less than 62 square miles of land, and it is home to almost 2/3 of the county's black residents. South of Central Avenue in St. Petersburg, there are only 3 places an expecting mother can receive full prenatal care. The Women's Care Center at Bayfront Hospital on 6th Avenue South and Planned Parenthood, which is nestled between Central and 1st Avenue South, barely make the cut. Heading farther south into the county's historically black neighborhoods, options dwindle to 1. In the heart of Midtown St. Petersburg on 22nd Street South lives the only other facility that offers full prenatal care south of Central. This is the Johnny Ruth Clark Center. Of the 3, the Johnny Ruth Clark Center and Planned Parenthood are the only low-cost options available to those who qualify, operating on a sliding scale basis. But St. Petersburg extends approximately 70 blocks south past Central Avenue. An expecting mother living in one of the southernmost neighborhoods of the city, like Pinellas Point, would have to travel between 40 and 60 blocks just to get to the closest facility, the Johnny Ruth Clark Center. From Pinellas Point Drive, it takes about 15 minutes to get there by car, or about an hour by bus, including a transfer, and 15 minutes of walking. Just a few blocks north of the Johnny Ruth Clark Center is STEPP Pregnancy Center, one organization that bridges the gap between expecting mothers and receiving the care they need. It has provided a limited range of free services to expecting mothers for the past 26 years. The center currently offers free pregnancy and STI tests under a licensed physician, counseling, and a points-based system that rewards expecting families with tangible resources like baby clothes, diapers, and strollers. Annually, STEPP averages just over 1,000 visits with about 700 families. Carol Alexander, the center's director, says the center will likely record even more visits in 2019. By October of this year, the center had already serviced 850 families, and each family typically takes advantage of more than one service.
For an hour, you earn $25 worth of stuff you can shop in the boutique. So we help them to see, and then that money, so maybe your goal is to get a car. So now the money you're saving on your diapers and wipes, we put in a car fund. So stretches your budget. So we use that as an opportunity too.
STEPP has plans to expand its services in partnership with Johns Hopkins All Children's Hospital's Healthy Start program beginning next year. These plans include the addition of a nurse practitioner to perform well women's exams on site and a community health nurse to provide home visits, a resource particularly valuable for families with limited transportation. The center keeps all of its services free through the use of grants and donations as well as fundraising events.
And one of the other things we're trying to do is to either get a grant or find some funding that will allow us to capture the data so we can really see that the way we provide service is making a difference. Anecdotally, I can tell you, we know what our rates are, but we really need to, have some data to back that up. And that's one of the things we're looking at doing, to see if our approach really does improve birth outcomes and breastfeeding rates.
While STEPP has made strides over the years to create health equity for mothers and children in South St. Petersburg, there is still a clear need for more change represented by the disparity in infant mortality rates in Pinellas County based on race. Southside St. Petersburg has a desperate need for more women's clinics.